This is Breast Cancer Awareness Month, but you know, we should be aware all the time, not just this month. And so to make sure that we do everything we can do, and wait till you hear some of the things that can help prevent breast cancer. Well, all of us at this table, we're talking about it. So the latest facts, we invited breast cancer surgeon, Dr. Kristi Funk. Good morning, doctor.
Good morning, ladies.
You know, I'm so prejudiced. I look at you and I think, she's so beautiful. Can she really be a good doctor? And you are. Isn't that an awful thing for me to say?
You know, it's a compliment. I take it as a compliment. When people say, nurse, here's my bedpan, I'm like, I'll get her. But thanks.
Okay, doctor, we hear so much about mammography. So 2 quick questions about it. At what age should you get it? What age should you stop? And then there's the digital mammography. Fill us in about that. What age do you get it? What age do you stop?
Start your mammograms age 35 baseline, if that one's okay, beginning at age 40 every year. Don't skip. Keep it at a 12-month interval. Why? Breast cancer doubles in size every 3 to 4 months. Okay. So keep it at the 12 months.
You start at 35, and then you don't have to do it again if everything...
5 years.
Until 40, and then every year.
Every year. Okay, don't skip.
Now, what's the difference between a digital mammography and a regular mammogram?
Digital versus the old school analog. Digital mammograms, only 20% of the breast centers in America have digital. They pick up more breast cancer in premenopausal, perimenopausal women and those with dense breasts.
Like a black
but how do you suppose your hospital doesn't have it? Or you said only 20% have it.
Only 20%. Why? They're expensive. They're $500,000 a machine, so we're slowly transitioning to digital. I'm very proud that my breast center, the Pink Lotus Breast Center in Los Angeles, offers digital. Okay. Here's the deal. When you have digital, it's like a camera. You can upload the picture.
But my point is, suppose it doesn't have it. How do I make sure? Do I just go from place to place?
Make a trip?
I would make a couple calls. Okay. Any major center will have digital.
Okay. I want to talk about things we can do every day to prevent. We understand that mammograms are important.
Right.
I hear there are recent news stories saying green tea is ever important in terms of prevention, correct?
This is well researched. So drinking 3 cups of green tea a day will decrease breast cancer by 50%.
And then what about
6 cups? Hey, can I get an 8 cup?
Don't be greedy.
Okay, what else besides green tea?
You can take 2 aspirin or ibuprofen a week and decrease breast cancer by 20%.
Why is that?
What about?
It decreases estrogen production in the body, and 85% of all breast cancers are fueled by estrogen.
2 aspirin or
ibuprofen, like Advil.
What about vitamin D? I've been getting tweeted about that a lot, taking a lot of vitamin D.
1,200 international units of vitamin D a day, and you will decrease breast cancer by 20%.
And swine flu also.
What about birth control?
They're saying swine flu also for vitamin D. That's what Dr. Lane
I thought you meant to decrease breast cancer. Go get
In terms of breast cancer, if you are high risk,
yes,
is birth control something that increases your risk if it's estrogen production?
Okay, there's a ton of data on this. While you're taking birth control pills, there's just a smidgen increase in breast cancer risk, but as soon as you stop, your breast cancer risk goes back to normal. And you have to look at who's taking birth control pills. Premenopausal women, your rate of breast cancer is very low. It's like for the decade of between 20 and 30 years old, 1 out of every 1,760 women gets breast cancer. So even if you double the breast cancer rate, that's 2 out of 1,700.
And
so don't worry about birth control.
Replacement? What about that?
That worries me. Right. So you need to think about why you're taking the hormone replacement. If it's for heart disease or osteoporosis, don't be taking HRT. This will basically double your rate of breast cancer. You need to be careful.
Right. So here's my question. Why does it seem that the rate of breast cancer is higher in the black community?
It's true that the death rate is much higher in black women. So the 5-year survival rate for all stages of cancer is 90% for white women, 77% for blacks. There's a few good reasons why. One is poor access to screening, so black women are not getting their mammograms. Therefore, their cancers are bigger and more advanced. Right. Then, once they have breast cancer, they have poor access to prompt, good health care. So their treatments are worse.
So it's not because it's in the genes or anything.
Actually, there is something in the genes. So biologically, black women have a 30% chance of getting a very aggressive triple-negative breast cancer. Remember I just said estrogen fuels breast cancer? Not so much in the black community. It's a much more aggressive tumor.
I want to talk about the program that you're teaming up with Yoplait for, Save Lids to Save Lives,
Yes.
correct?
Yes, so there's much work left to do in the fight against breast cancer, and Yoplait's Save Lids to Save Lives is such a simple, fun way for everyone to get involved and contribute. All you do is save the pink lids from your yogurt cups, mail them in by December 31st of this year, and Yoplait donates 10 cents for each lid to Susan G. Komen for the Cure, up to $1.5 million, and they guarantee a $500,000 donation.
Thank you so much,
Yes.
Dr. Funk.
Thank you.
We just want to tell you, in addition to this wonderful advice, that everybody in our audience is going home with a pink 100% cashmere pashima from Yoplait. We'll be right back.